One of my favorite new partners is Warrior Salt. We talk on the show. We're trying to empower you to mind, body, and energy. Energy starts with being hydrated. Let me tell you, after a workout and if you're eating a healthy diet, it's hard to get enough sodium. Well, you wouldn't believe it. We were coached for so long that sodium's bad, but that's why I love this partner. No BS, just electrolytes. They keep it simple. We're talking about fruit powder and salt. There's no stevia, no citric acid, none of the bad stuff, just the stuff you need to stay hydrated. That's what I'm doing. I go to a workout, before workout, after workout. You need it both. If you're thirsty, you've waited too long. That's the point. With Warrior Salt, again, it's all about simple hydration that you need without anything that you don't want. One of the official partners here of Vibe Science as we take you to your highest vibe. Hey guys, on today's Vibe Science, I talked to Dr. Ben Thompson. He's the founder of Treble Health. And again, talking about that connection of the ears, the brain, and the vibration things that we hear, how it's all connected to our wellness and health. We've talked about the sinuses and the ears. Dr. Ben at Treble Health talked about what you hear and how that talks with your brain. And neuroplasticity. Yes, I said it correctly. All that and more today on Vibe Science.
I think it's important to realize that our hearing is one of our five senses, but how often do we think about it? How often do we try to optimize our health for it? Usually not that often. It's interesting how we can close our eyes, but we can't close our ears. The ears in the hearing system would not be the first thing that most people think of, but the research found that it's actually one of the most important factors to get right, along with diet and exercise and socializing, essentially. If you have anxiety, stress, or sleep problems, everything gets turned upside down. Therefore, doing everything we can to reduce tinnitus is a big game changer for someone's overall health.
This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here's your host, Ryan Alford.
Hello, and welcome to Vibe Science. We're always here to take you to your highest vibe. It's my mind, body, energy, and sound. A little bit of everything. And you know what sounds good? It's the good doctor. He is here with us today. What's up, Ben?
Hey, how's it going, Ryan? Great to be here.
Hey, it's good to have you, man. I love what I'm seeing from Treble Health as a guy that grew up with a father in music. Whether it has anything to do with it or not, when I see treble, I think back to my piano lessons, and I think my dad in music always talking about it. But I'll let you expand if it has anything to do with that.
That sounds great. And yeah, when I think of treble, I think of on the radio dial, bass, mids, treble, sometimes feeling like I could customize the song to make it sound better. It usually didn't sound that much better.
I know. So you've been all around. We talked pre-episode. We're in Greenville, South Carolina. You were from Rhode Island, went to Charleston. What got you into health and medicine?
Yeah, what got me into health and medicine was learning about how the ear connects to the brain. And it's surprising, but the hearing system, our ears and our brain, it's a lot more tied to longevity, cognitive function, keeping stress in check. So I'm excited to share some about that. My specific journey was I was a music lover, and that led me to learn about the health of the ears, protecting our ears. And that eventually led me to specialize in tinnitus, which is often pronounced tinnitus, ringing of the ears. Both pronunciations are okay. Most of the world says tinnitus, but the correct pronunciation is tinnitus.
I'm glad you went there, Doc, so I didn't have to. I didn't want to say it wrong or reverse those things because like I said, pre-episode, a lot of people probably say it wrong with just a lack of knowledge, or like myself, more than not education. Talk to me about, it's interesting. I just did an episode with someone that was talking about the connection of the nasal passages, the ears, the hearing, vibration, all of these things. And it's really fascinating how we're learning that sound and vibration, the brain, the stimulation of all of that works together. I'd love, you to answer and kind of connect those dots for me a little bit with what you're seeing, and then, what you're kind of doing specifically in your space.
Yeah, I'd love to. For everyone listening, I think it's important to realize that our hearing is, one of our five senses, but how often do we think about it? How often do we try to optimize our health for it? Usually not that often. It's interesting how we can close our eyes, but we can't close our ears. So sound is constantly coming in, and sound goes in through the ear canal, goes past the eardrum, and then there's the three smallest bones in the human body, the incus, malleus, and stapes. Actually have an example for those who are on video to visually see.
I love this.
They're about the size, each of those are about the size of a grain of rice. Those sit behind the eardrum that pushes sound through into the cochlea, the hearing organ, and then it becomes a response picked up by the brain. So it is fascinating how we hear and how we can perceive so many different pitches. That's how the hearing system works.
Man, it's I don't know. I grew up with playing music a little too loud, doctor. But luckily I did not lose my hearing like some of my friends that are completely deaf. But it's so fascinating when people say things that are simple but kind of like awaken something in me. Then the comment that you made about you can close your eyes but you can't close your ears. Everything in our body seemed to be purposeful. That was just that kind of enlightened me in some way, because we're constantly hearing, or we have these vibrations of different things going. I don't know if you can expound upon that, but I found that really interesting.
Absolutely. So from an evolutionary perspective, hearing is one of the ways that we stay alive as a species, stay alert to predators or sounds or dangers. And the good positive sounds that we want to hear more of. So because of that, even when we're sleeping, we still need to be able to hear. And we've all woken up in the middle of the night. What's that sound? Am I in danger? So I think probably that's why we haven't closed our ears. I prefer to sleep with a quiet environment, earplugs or a sound machine, rather than keeping my ears open. What music did you play? You said you're a musician?
Yeah, I play guitar and I took 5 years of piano, but I admittedly don't bang the piano much anymore. I can play. Grew up in a musical family. My dad's been in a band, not one you've heard of, but all my life. But he's a good musician. I mean, he plays 7 instruments, can pick up here. He played an ear, so to speak. I've got a little bit of that, but I'm definitely more. I don't know. I grew up in the Dave Matthews era of acoustic rock. And then now if I pick it up, I'm just kind of picking James Taylor or something, acoustic like that. But that was my stuff. And then, but I got into everything from, classic rock to rap, like most people throughout my, journey with the tunes.
Nice. I
How
love
about yourself?
it. And what about your father? Has he ever had any hearing issues that he's discussed?
No. My dad's like, I don't know. He's an old soul. And I mean, he had his rock and roll days, but he was always a little practical. Like, I think he probably maybe more than I am, with not like just complete, like absolute sound turned all the way up. He played with some guys that was more like 60s rock and stuff. So it's kind of like more in tune with the tunes than just out and out banging and loud, bass and treble at the maximum levels.
Yeah, that's interesting. A lot of the patients I work with in my practice are around your father's age. And one of the fascinating things that's come out in the last few years is this study from 2023 that linked hearing loss with risk of cognitive decline. And specifically, it found that for individuals who had some risk of dementia, that if they had a hearing loss, actually treating hearing loss with hearing aid treatment, with hearing better, that significantly reduced the rate of cognitive decline for those individuals. And that's really important, because if you speak to people in your father's age range, that is a huge motivating factor for them to take care of their cognitive health.
Did you know that bad hearing can lead to cognitive decline? Yes. That's what Dr. Ben and I talked about in this session. We talked about the connectedness to hearing decline and the mental decline that comes with that. Also, when people are in the early stages of dementia, how they typically have bad hearing, and that getting that taken care of is mightily important to reducing that decline. We talked about that and more in this segment right here. Yeah. You know what, doctor? That's fascinating, because my mom is in the early stages of dementia and she has bad hearing. And she's, physically, has a body of a 50-year-old and she's 73, like she's physically fine, but she's had mental decline, memory decline, and she has had a bad hearing for that is interesting. And I think, some of the specialist things she's talked about have brought that up, and she's worn devices and things. What's interesting and fascinating, and I say this to my mom and even my stepdad, like there's some of these things with mental decline that there's ways with which probably to reduce them. But it's been fascinating to watch how little my mom would kind of stick with things, like that seemingly have have incremental impact. But I don't know why that is. If we just get stubborn in old age, or like if we don't think they're helping, or I don't know. We're going down a whole other rabbit hole, but it's interesting because you've nailed right a path with which I've dealt with.
Yeah. So in a situation like your mother's case, it's just important to recognize, okay, what's in our control here? In her case, what can I do now to help my cognitive health? In other people's case, what can I do to prevent that as much as possible in the future? And it's the ears and the hearing system would not be the first thing that most people think of, but the research found that it's actually one of the most important factors to get right. Along with diet and exercise and socializing, essentially.
Well, she's good at that. She's still knee deep in the social aspect, so it's keeping her younger.
Great.
Doctor, talk to me about what you're doing at Treble Health.
Yeah, so my journey with Treble Health is I'm an audiologist, a doctor of audiology, and I specialize in tinnitus treatment. This is people who have bothersome ringing in their ears, ringing, hissing, these kinds of sounds. Unfortunately, there's a belief out there that you just have to live with tinnitus or there's nothing you can do. But through my specialized training, I learned that's not the case at all, that for many people, they can reduce the tinnitus sound that they hear by 50% or more. And that really changes people's lives because this is a serious problem. It's an invisible problem. It's often linked to hearing loss, but sometimes not. So people who have worked around loud noise like military or gunfire or musicians or heavy machinery use, they will often say that tinnitus is the worst health problem they've dealt with, and it hasn't gone away. So I started Treble Health, and we're a private practice. We have 3 locations: San Francisco, Miami, and Charlotte, North Carolina, and more to come. We've seen many patients via telehealth. So we're providing tinnitus treatment that helps reduce their condition and get their lives back in order, really.
We can rewire the brain. That's right. The brain can be rewired. Neuroplasticity. Dr. Ben Thompson and I talk about that point right here, where he talks about how you can use sound and hearing devices to change that neuroplasticity to reduce ringing and also improve your overall wellness. I don't know why, but this is another one that will either don't hear about it at all or you know all about it because you either have a loved one or something else. I've had a lot of people that I knew that have had this ringing in the ears. And you talk about something that I think seems so minor, but until you have to deal with it. And I've just watched enough people. I've been fortunate. Maybe one day I'll have to call doctor here for some help, but hopefully not. But it is debilitating and just an annoyance that I've seen. And I think it's one of those things that, no pun intended, you don't hear about it unless you're literally having to go through it or have a loved one. But what are some of the advances you guys are doing or things that are happening in this space that Treble Health is helping with eliminating?
Yeah, the main approaches include a sound-based treatment, typically with medical devices worn on the ears, where certain sounds played over time can reduce tinnitus by promoting something called neuroplasticity. So it's amazing that researchers have found that, hey, our brains can change for better or for worse, but our brains can change when we influence it in certain ways. And that's called neuroplasticity. Well, tinnitus treatment is neurological. It's in the auditory brain. So it can actually get better over time through a sound-based treatment and also a cognitive-based treatment, one that includes fundamentals of psychology, like changing the brain's reaction to the sound. So we look at anxiety, stress, insomnia, sleep problems. And if you optimize those areas over time, tinnitus gets better. The innovation that we've brought is we've used telehealth. We've used the technology available to actually remote program these medical devices and use Zoom sessions as the consultation format. And we've been able to reach thousands of people. Similar to you, I also make educational videos and have podcast conversations. So our YouTube channel over the last 5 years has over 150,000 subscribers. So there's a lot of people with this problem, and there aren't so many great resources out there. That's why Treble Health has grown and been able to help patients.
I love this. A lot to unpack there, Doctor. I love the way you're using technology to personalize health and to expand the availability of it, because I understand there's certain conditions where you have to walk into the office and be seen, or there is a need for that. But then you have these acute things like this, where you're figuring out how to leverage technology, being a younger guy, a younger doctor, bringing the technology together with the personalized care to solve something that can be debilitating. I love that, number one, which is what this show's all about, is kind of shining light on services and things like that because of how complex mind-body energy is. And then the way with which you can program remotely. I mean, there's like a great technology story along with health story here. And I think it's great, man.
Yeah, thanks so much. It's been amazing, and we're excited about opening more physical locations, which is really bringing this specialized care to people that need it. So yeah, Ryan, I love what I do. It's definitely a labor of love.
How has that gone? Has it been, from a business perspective and expansion? What are kind of the plans?
Yeah, so the plan is that we know that tinnitus is a big problem. Most towns and cities do not have a true specialist that can help them. So we are connecting people who need the help with specialists or doctors who actually can work with them on this. So we're looking at continuing to grow our telehealth practice and opening physical locations in select cities or areas where we have a specialist who can really help the patient. Most people would find us through our online content or doctor referrals, and then they'd be able to work with a specialist, which, again, I'll just say, most people are told there's nothing they can do about the tinnitus sound. They're told you just have to live with it. There's no cure. I don't really know how to help you. But like I had mentioned, if the problem can improve by 50% or more, wow, that can really change someone's life. So the help is out there, and we're working towards connecting people who need it with the doctors who specialize in it.
I love that. Almost like a hub and spoke model. Like you've got the like larger cities having, your specialists, and then you can push them out via tele or whatever. If someone needs to come in necessary, that's fine, I imagine, but you can actually, using the technology, sort of beam them wherever they need to be via Zoom, right? And coming into those small cities and towns where someone can do it over the Zoom call, and then, diagnosing and spreading it out from there. Am I getting kind of the process right?
Yeah, definitely. So there's a hybrid model where we give the flexibility of have Zoom consultations and maybe do remote programming of the devices. We also give the comfort and the safety of, hey, I want to see my doctor in person. Hey, I want to go see someone physically for this.
What, as we close down here, doctor, talk to me about, knowing what you know in this space. Like, are there innovations coming? Are there other things coming related to that sound and improvement of the tinnitus and anything else, that relation of the brain and sound?
Yeah, looking forward, I think most people with tinnitus or hearing issues, they need to know that, number one, this is not just an ear problem. This is a brain problem. Research, as we discussed, research is showing strong evidence of, hey, if you care about your cognitive health, because Ryan, for all the patients that I speak with, hearing their wife better, yes, but they're not so jumping out of their seat to do it. Improving their cognitive health, reducing their risk of dementia. Wow. That is really serious. People take it seriously. So that's an important piece I want to impress upon everyone. That research is growing and becoming even more clear about what that means. But certainly for most people, it means if you have a hearing loss, you should treat it with hearing aids. With tinnitus as a problem, the research is really clear that, hey, this affects stress, and it creates stress, anxiety. It can cause insomnia. And as you know from your work, for mind, body, energy, if you have anxiety, stress, or sleep problems, everything gets turned upside down. Therefore, doing everything we can to reduce tinnitus is a big game changer for someone's overall health. The specific tools or technologies of how the treatment goes, there's a few in development that I have our eyes on and we're monitoring. There's some great tools available right now. Moving forward, there's research ongoing that could make it even better.
Where can everybody keep up with what you're doing, doctor?
Yeah, so if anyone has tinnitus or someone they know has tinnitus, we created a free online assessment called tinnitusquiz.com, where patients or individuals can go and answer a few questions and then receive next steps based on what they're going through. Additionally, you can follow us at Treble Health. So treblehealth.com, that's where you could reach out for a free consultation, look at our physical locations in the United States. And then if you want to follow us on YouTube, we're at Treble Health on YouTube. Thanks, Ryan.
Really appreciate you for coming on, doctor. Hey, guys, you know where to find us, vibescience.com. We'll have all the links, the highlight clips, and ways to get in touch with Treble Health and take advantage of that. Look, we talk about it on the show all the time. Mind, body, energy, interconnectedness for total optimal health. You don't want mental decline just because your ears are going bad. Trust me, we all, as doctor said, care about that. We want to live well, not just long. We'll see you next time on Vibe Science.
The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe.